Humphrey, and I chose to research women's health in developing countries for my Bio Expo project. This is a topic that I became really interested in last summer. I went to Tanzania for 2 weeks and did a medical immersion trip through an organization called Projects Abroad. And while I was there, I realized that women's health and newborn care are two areas of healthcare in developing regions, and specifically Africa, that are not as focused on because women in these areas face large setbacks such as regional setbacks, a lack of access to healthcare because they're so far away from clinics, and then also there's a huge idea of men being in charge of women's health. So it just creates this cycle of women losing autonomy over their bodies. While I was there, we worked in different clinics, so city hospitals, rural clinics, specialty centers for kids who need occupational or special therapies, and then we also did outreach to traditional villages, which is one of the stories that we'll focus on today. So these are just some pictures that I took while I was there and we were doing outreach. So I'm going to talk about my mentor because we had to find a mentor who would help us with this project. So my name was Jessica Cohen, and she works at PATH. PATH is a nonprofit whose headquarters are in Seattle, and this is from their website. They are described as a global team of innovators working to create sustainable and equal healthcare around the world. And they also make sure that their work is positively impacting these communities. So they're working to solve really pressing healthcare issues like malaria, issues with women's health, contraception, newborn care like pneumonia, and then other neonatal projects. And they really try to focus on regions where there's regional boundaries, so people aren't able to access it. There's a lack of supplies and a lack of knowledge. He also challenged me to address the topics that I'm going to be talking about from different angles so that we're able to get a broader perspective of the project. For this first activity, this will be yes, and then this will be no. So the first question is, I am in high school. Yeah, this is yes, this is no.
It's a test, see if you know it.
The next question is, I am a female or identify as female. I go to the doctor when I'm sick or have a medical issue. This is a lot of movement. The doctors I interact with are knowledgeable and have attended a higher level of education to become a physician. I have access to birth control if I want it, regardless of my guardian or partner's opinion. I have to walk many miles to the nearest medical clinic in order to receive a healthcare treatment. I believe that healthcare and medical attention is a human right. In the U.S., healthcare is non-discriminatory in the sense that people who are sick can receive medical attention regardless of race, gender, sexual orientation, or financial ability. There are differences in healthcare between developed countries and developing countries. Does anyone have any ideas of some of these differences?
Doctors there are, what type of doctors, and like surgery, like other heart surgeries, brain surgeries.
Okay, so now we're going to go sit down and then analyze some case studies that relate to the topics that we just covered. Studies that we're going to be using to compare the experiences of a doll who is 25 and lives in Africa and has 4 kids. And she has to walk many miles to the nearest healthcare clinic and lives at her home at the base of Mount Meru, which is it's a mountain outside of Arusha, which is a really popularized city in Tanzania. And then also Jenny, who is 26 and works at a marketing firm in the US. So you guys, this is like an intro of the case studies that we're going to be talking about. So then flip to the first page, and it'll say case study 1. So the case studies that I've created highlight the differences between these two women's experiences. And the first is what many women face in developing countries as a result of gender inequality that can limit their access to and use of birth control. So does anyone want to read Adal's portion of the case study 1. It's the first paragraph. Or I can.
Read it.
Okay.
In Tanzania, a woman named Adal, who is 25, walks from her rural village at the base of Mount Meru outside of Arusha, a developed city. She has 4 young kids, 3 sons and a girl, all under the age of 6. With her husband working in agricultural at her village's farm, no car or other type of transportation available so far out of the main city. In a long day ahead, she walks 7 miles to the nearest healthcare clinic with her children. She doesn't tell her husband the real reason she's going to the doctor, but rather says she thinks she may have pneumonia. She is going to a doctor in order to receive a long-term birth control method that will prevent her from having a 5th child.
So this is a hospital that we worked at when I was in Tanzania, and as you can see, it looks nothing like we would see here, like at Seattle Children's or Swedish. So this is where surgeries would take place. People would go to receive some healthcare attention. But if a doll wants to get a long-term method of birth control, she's going to go to a women's center because birth control isn't often distributed at just generic healthcare centers. So she'd go to a women's center like this. And as you can see, there are many beds in one room. There are very close quarters. The windows are always open. So you can imagine just the difference that we'd have here. Like, I don't know if any of you guys have been in the hospital, but you usually have your own room, closed walls, individualized nurses. So it's just an interesting comparison to think about. In the US, a 26-year-old woman named Jenny has booked her appointment far in advance in the middle of her day working at a company where she is in charge of marketing. She leaves her office and heads to the doctor's, 15 minutes away. She drives her car there and stops for coffee along the way at the nearest Starbucks. Her and her long-term boyfriend don't have any kids and don't want them anytime soon, so she's visiting her OBGYN to evaluate her birth control options. So this is what Jenny's drive to her OBGYN would look like. 15 minutes versus the 6+ hours that a doll would have to walk. And then this is just a comparison of contraception use around the world. So as you can see in North America, it's like a huge comparison to Africa that has like only 30%-ish contraception use. And abortion is where it really highlights the challenges that women in these areas face. So as you can see, the green is broadly legal abortion laws, and that includes the US and other countries, and then a few in Africa. But the red and the yellow is where abortion is allowed within condition or heavily restricted. So for women like a doll, this is not an option whatsoever. And if she has another pregnancy, it can be really detrimental to her own health and her children's. So I'm going to read Adal's statement. Adal is grateful that the doctor gave her the injectable birth control shot because she doesn't know if her body can take another pregnancy. She also knows of friends who have gone to local healers to end unwanted pregnancies because they were afraid to go to a clinic and have gotten serious infections or even died. And in comparison, Jenny knows that her chances of pregnancy are low given that she has the IUD and they use condoms when having sex. If the 99% protective IUD and condom protection methods fail, she knows that there is Plan B available at a local Walgreens or an in-office abortion to end her pregnancy. In countries, as you can see, non-poor regions, it's usually nurses, midwives, doctors, and then a small percentage are done by untrained providers. But then rural and poor regions, it's much more concentrated with untrained providers or the woman herself. So in the US, there are 1.1 million people living with HIV, and this was at the end of 2015, so slightly outdated. But compared to sub-Saharan Africa, there are 22.5 million people in sub-Saharan Africa living with HIV. That is 7 times the Seattle area population, 562 times Mercer Island's population, and 3 times the population of the state of Washington. So as you can see, this is a huge number in comparison to how many people are living with it in the US. And some reflection questions. What ideas do you have to improve any of the following areas? And then I listed a few below. So access to healthcare for women in rural areas, contraception use, reducing HIV prevalence. I think that one would just be making contraception more available to women in areas where it's not as easy to receive it. And I think that that's something that we as people in a developed country who have many resources can work with doing.
Just making a law so that